One of the most challenging clinical situations we have is when a pregnancy test comes back negative following frozen embryo transfer. Patients call us, they're devastated, and they want to know then, what do we do differently? Do we just do the same thing over and over again and hope for a different result, or can we actually make changes? Two things that we can do that we found to be very successful and very effective are to put patients on antibiotics and also to put patients on steroids. So let's talk about that in some detail. We would, if your pregnancy test comes back negative, offer you and your partner some antibiotics, either a Z-Pak or some doxycycline. The reason we do that is just in case you have any subclinical infection going on in the uterus. In other words, there could be bacteria there, but not enough to actually cause symptoms. But it's so easy to put you on antibiotics, the risk is essentially zero, and it's been shown in several studies to actually improve the likelihood of success. The second thing that we do is we can put you on steroids. Lots of different types of steroids out there. We have a very specific regimen that we use. It's been published in many studies, and it also shows that if you have subclinical inflammation, so in other words, you might have a condition called endometritis, which is not an infection of the uterus, but rather inflammation, that this can treat that. So by putting you on steroids, it lowers the level of inflammation. The white blood cells that are migrating to the uterus to fight that inflammation subside, and therefore it does increase the likelihood for success.